Hello everyone, I am Dr Namita Jain, consultant Obs and Gynae, working at Paras Hospital, Gurgaon. Today we are here to discuss about common gynae problems which females face. Every woman once in their lifetime experience one or the other gynae problems. It can be a problem during their periods, it can be painful periods, urinary infection, vaginal infection, or problem in conceiving. To start with period problems, periods can be painful. To begin with, once the female starts having their periods, their pain is slightly tolerable. In case that pain becomes severe, patient requires painkillers 2-3 times in a day, she requires injectable painkillers, or if it is associated with nausea, vomiting or headache, she needs to consult the specialist for the symptoms. It can be sometimes associated with endometriosis. What happens in endometriosis, the flow of the period which usually comes out during periods, it goes back and deposits in the uterus, it can get deposited in the ovaries, which leads to painful periods. Other than that, periods can be delayed in some patients. Sometimes they are dealing with conditions called polycystic ovarian syndrome. That patient needs to be evaluated by getting their blood test done, their periods chart need to be maintained. They need to get an ultrasound to make a diagnosis. And once the diagnosis is being made, the lifestyle interventions are being introduced in form of diet and exercise, and sometimes these patients require hormonal therapy to regulate their periods. Women with PCOS, they have sometimes require minimal assistance in conceiving also in form of drugs to make a proper egg so that they can conceive. There are other problems also, like females when they are traveling, they are afraid of using public washrooms. So they tend to avoid drinking water, they tend to avoid washrooms, so that probably increases the chances of urinary tract infection. So I would like to counsel that they should drink plenty of fluid so as to avoid urinary infections. And once a female is introduced to sex, she is prone to urinary infection as the length of the urethra, the urine pipe, is small in females. So soon after intercourse, they should go and pass urine, and they should clean themselves from front to the back. There are other conditions also because of the delayed childbearing, because of the rampant increase in pollution. Females are having problems like fibroids, जिनको हम आम भाषा में रसौली कहते हैं. These problems are increasing day by day in our clinical practice. Also endometriosis. A female who hasn't given birth, even till late childbearing, they are more prone to conditions like fibroids and endometriosis. And one should need to take a specialist opinion while going ahead to manage such issues. Other than that, infertility per se, I would like to counsel all the viewers that any patient who is unable to conceive even after 1 year of unprotected intercourse, they should consult the specialist as a couple. Both husband and wife, they should meet the specialist so that a proper plan can be made and investigations can be done so as to deal with the problem. I would like to thank my viewers for watching this video.